timing of the release of the data. By choosing to go with the state data, it will hopefully eliminate that question. Number 2, as the state started to develop its policy frameworks, we began to obtain more insight into the data sets they were using and analyzing to make their decisions. Therefore, using their data helped us align and, to an extent, predict our responses to their requests. The state data reflects 33 hospitals in its reporting. I would like to clearly articulate what types of hospitals they are. 26 of those hospitals are emergency receiving centers with licensed ICU beds. Note that CHOC is split into its Orange and Mission Viejo campuses. 4 of the 7 non-included facilities have no licensed ICU beds. Those facilities are Healthbridge Children's Hospital, College Hospital Costa Mesa, Hoag Orthopedic Institute, and Encompass Health Rehabilitation Hospital of Tustin. 3 of the 7 non-included facilities are Kindred Hospital's locations in Brea, Santa Ana, and Westminster, which are transitional care hospitals that would receive transfers from the 26 traditional OC hospitals. This data is entered by hospitals into an online web interface at the end of each day. In regards to data availability, the Communicable Disease Control Division of the Healthcare Agency receives the CDPH file at approximately 2 p.m. 7 days per week and will provide to OC Information Technology at 10 a.m. to prepare for the day's web posting. With today's posted data and moving forward, users should not compare today's hospital ICU website data to any prior posted hospital ICU website data. HCA is making improvements to its website. The public can expect to see an improved website within the month. With summer approaching, I'd like to also provide everyone with an update on where we are with reopening public swimming pools in Orange County. Please understand that the county's position is to open pools immediately. However, the state has confirmed multiple times to us prior to Tuesday's board meeting that public swimming pools are not part of Phase 2. Following the board meeting on Tuesday, HCA reached out once again to the state to request that pools be opened. The state acknowledged our request and indicated that it will be releasing guidelines soon for pools. The exact timing of that release is still pending. HCA currently has its pool guidelines posted online. Our recommendation would be for any organization interested in being able to operationalize their pools immediately once the state responds is to review our guidelines in preparation. Thank you.
Good afternoon, everyone. I'm Frank Kim from the County Executive Office, and at this time, I think we'll take calls from the media. And again, please be patient as we're using our modified protocol today for media questions.
I have a question from ABC7.
Yes, please go ahead.
Yeah, with all the protests happening across Orange County, people being in close proximity, obviously some wearing masks, some not. What is the message to people out there? Are you guys worried at the same time that there will be a spike because of this? Can you talk a little bit more about protests in relation to COVID-19?
Certainly. I think from a county perspective, we're always concerned when we see large group gatherings. And I think it's a real balance between preserving the rights of individuals to express their First Amendment rights, as well as a desire and a request from the county that individuals do their best to maintain their 6 feet of social distancing and use all precautions that are necessary in order to protect and preserve their own personal health, as well as those of other protesters and their family members within their home environment. So yes, is it a concern? Absolutely. Do we respect their right to protest? Certainly. We would hope that they would do so and use as much caution and safety protocols as reasonably possible. I don't think that it's really something that we can expect that there's going to be a hand washing station in all the areas of protests, or that as protesters are rallying that it's possible to maintain 6 feet of social distancing at all time. So I think that is a concern, that certainly if there are individuals that are COVID positive in those environments, that there is risk to the other members that are protesting. So is it a concern? The answer is yes.
Next question, please.
Hi,
Can you hear me? This is Shayna Stabler from Stu News.
Yes.
Hi, thank you for taking my call. Out of the 1,440, the number of cumulative tests to date, how many of those are from skilled nursing facilities? While we see the positive test rate going down, we also know that in many facilities, residents and staff have been tested 4 or 5 times per resident staff member already. This is great news, and it is something that is needed to help contain the spread of COVID in these facilities. However, the data is questionable as far as the positive test rate in our overall community. Will you be posting the number of tests conducted within skilled nursing facilities out of the overall total? And also, can you please tell me why Dr. Quick or Dr. Chow are not on this call?
Hi, Lily Simrain with the Healthcare Agency. I appreciate the question. We understand that skilled nursing facilities is basically our priority in the hot zone for the county right now. I appreciate the feedback that you just gave about what type of data would be helpful for the public and for others to follow as we go through COVID-19. As you know, on our website, we already post and differentiate out the SNF cases and the SNF deaths from the totals that are on there in regards to testing and which ones of those, how many of those tests are attributed to the SNFs. That is a conversation that we are having internally because of the fact that it takes about 24 to 48 hours sometimes for those tests to come back. So we don't want to be posting up anything up there until we are quite certain that that is a positive test.
Next question, please.
Thank you.
Hi there, it's Leilon from the Orange County Register. Going back to your public swimming pools, did that request also include private pools within HOAs, community apartment buildings, that sort of thing? And then as summer gets underway, we're seeing a lot of schools let out already, and obviously big gatherings not allowed this year. What are some of the recommended activities that people can do this summer to keep their kids entertained?
So to your first question, I might have to ask you to repeat the second part of your question because it's slightly different. To your first question, we have a list of example swimming pools that fall under the category of public community swimming pools on our FAQ webpage on our website. I believe if I could just name off a few off the top of my head, HOA pools are included in that. Basically, any public pool that does require any kind of healthcare permit to operate is what qualifies under that. Swim schools are a completely different category. That's our understanding because it is a business. And that question is another business sector that has been raised to the state's attention as well, not just by our county, but by other counties, and we have not received a response on that. And then the second question, if you don't mind repeating.
Yeah, the second question, we're seeing a lot of schools let out for summer, and obviously with big public gatherings not happening or big events, the fair, other festivals, and a lot of the cities, community classes not happening. What are some things that some of the school-age children can do safely this summer?
So I believe that the state has signaled to us that they are aware that there have been a lot of questions and interest around summer camps, dance schools, gym, different things like that they need to get ahead of. The last time that we spoke with the state, they had indicated that they would be releasing those guidelines soon. Again, the common process with the state is that we are given a heads up about what sectors they are focused on, and then we are given a TBD in terms of when those guidance will be released or how we would go about actually ensuring that those sectors can properly open. So those have been brought up in state conversations. In regards to what kids can do for the summer, we have never shut anything down in this county through our own orders. That has been primarily through the state's orders. Our parks are still open. I see families hiking at Peters Canyon all the time. I see kids taking walks and riding bikes along the streets all the time. I know that a lot of parents would like to take comfort in the fact that there is some kind of organized activities for their children to partake in that would probably most likely involve being outdoors. And so we understand that, and we will continue to push for that and advocate for that. But at the moment, we don't have any guidance, and we certainly are not discouraging anybody from going outside and taking long walks and playing in an open field or anything like that.
Next question, please. always believed and continue to believe.
I'm having a hard time hearing you with the question. Can you please speak up into the microphone? Thank you.
The elections
Hello?
support the book of law enforcement. I say this not only as Secretary of Defense, but also as a former soldier and a former member of the National Guard. The option to use active duty forces in a law enforcement role should only be used as a matter of last resort, and only in the.
Hi, this is Spencer Custodio from Voice of OC. Can you hear me?
Yes, I can hear you, Spencer. Go ahead.
Oh, okay, excellent. Thank you. Thanks for taking our question. I was just wondering if there's any talks or any plans, or if the officials are looking at a countywide curfew for the protest, and also if there's any plans to increase some of the, I guess, some of the sheriff's deputies to help assisting some of the cities. I've noticed, like, for instance, in Anaheim, deputies were helping, monitor some of the traffic concerns, and I think they were out there in Garden Grove yesterday.
Thank you for that question, Spencer. So the sheriff has activated the Emergency Operational Center, as well as many cities have activated their emergency operation centers as well. So I know that law enforcement are having regular communications in terms of the protests that are planned for Orange County. I think we've been very fortunate that the protests within Orange County have been largely free of the kinds of incidents that we've seen occur in other large urban areas. So we definitely appreciate our members of the public protesting and expressing their First Amendment rights in a way that does not lead to destruction of property and other issues that we have witnessed. In terms of your specific question on curfews, I'm not aware that we have considered issuing any countywide curfews, but I am aware that as cities take those planned protests and review of their law enforcement response related to their jurisdictions, some cities have enforced curfews, and that may continue as well, but those are local city decisions. From a county perspective, we don't have any plans at this time to enforce the curfew, but obviously it is something that is available to us if needed.
Next question, please.
It's Paul Anderson with City News. Could I ask a question?
Sure, Paul. Go ahead.
Yesterday, I think most of the fatalities were from skilled nursing home facilities, or all but one. And I was wondering if I'm looking at this site right, were 6 of the 7 reported today from skilled nursing home facilities as well?
We're checking on that right now for you, Paul. One moment. Can you repeat the question, too, for us?
I think the question was, of today's reported death number, what of the total reported death are from skilled nursing facilities?
Yeah, that's right.
So, Paul, we'll get that information to you after we get off the call. I don't have that data at this moment.
Can I ask real quick, is there anything that you're doing extra this week in terms of, the outbreaks in the nursing homes?
Yes.
Anything extra or different?
Hi, Paul. Yes, so we are increasing our testing capacity so that we can go out and address more of the outbreaks at the skilled nursing facilities. So that is one thing that we are doing. We are also increasing the number of staff that will be working at the skilled nursing facilities to monitor. And of course, we are continuing to work with UCI to work on a training curriculum for our skilled nursing facilities to ensure that their facilities are hygienic and that they are taking the proper precautions to mitigate the spread of COVID-19. We are also, in terms of the PPE, we still have an adequate supply of PPE for our skilled nursing facility. I believe that you might have also heard that the feds were sending out supplies of PPE to the skilled nursing facilities as well too, and we are starting to see those roll in. They are not completely all here yet, and so I think that what you are seeing is an increased response. I think that you're also seeing more of an organized and uniform response in how we are dealing with the skilled nursing facilities.
Next question, please. Members of the media, do we?
Yeah, I have a question. Do you guys hear me?
Yes, we can. Go right ahead.
Yeah, it's Corbin with KFI. Regarding the mask mandate, is there a potential end date for that being considered? Is the county still basing that on the what Dr. Quick said at Tuesday on an increase in community spread? And what would you say to all those people that are still protesting about having to wear masks?
Well, let me represent the healthcare agency point of view here. From our point of view, which is very much the medical and the science perspective, is that COVID-19 is still here. There is not a vaccine and there is not a treatment. What we have seen that has worked in the past has been the physical and social distancing that everybody has put in place. It has been the cognizant behavior of individuals to wear masks. What we are hoping that everybody will understand about the masks is that it is not for your individual protection primarily. It is so that you could protect others in the community from potentially contracting COVID from you if you did not know that you have it. We are actively monitoring the indicators that the chairwoman had indicated earlier to determine whether or not we are going to continue the mandate or if we should loosen the mandate. Should our numbers start to look better, we will have that conversation. Our department will make sure that we will provide the medical science and the facts to the policymakers, and then they can make that decision. I don't know if Frank has anything to add from that end.
Next question, please.
I just wanted to, if I could follow up on that, just because of the people that were speaking and have spoken about the mask mandate and they're, talking about shaming of mask wearing. Just could you just make a couple comments for people that are having trouble accepting the mask mandate?
Sure. At the healthcare agency, we are people too, and we have families, and we like to go back to what we had before as well too. So when we make some of these recommendations, we take into consideration all of those aspects of our daily lives and how we could continue to function and as normal of a atmosphere as possible. So what I would like to say to individuals out there who are concerned about this is your concerns are the same as our concerns as well too. My husband likes to go on long bike rides. He doesn't have to wear a mask because it's going to be difficult. I respect that. We all talk about how when it comes to the face covering mandate, it is very clear that you put on a face mask when you cannot maintain the 6 feet of social distancing. If you can maintain the 6 feet of social distancing, you have a choice to put on a mask or to not put on a mask. But all we are asking individuals out there, regardless of whether you are for the mandate or against the mandate, is that everybody just remember for a second that we are all in this together. This virus, again, has no vaccine, has no treatment. And so the only things that work are prevention measures to this extent right now. And the masks is one of those prevention measures. And when Dr. Quick made that decision to put that in her order, she was really coming from the perspective of the medicine and the science, and also from the community perspective. So we understand the frustration. I get it too. But, I don't know what else to say besides that we get it, we understand it, but we just want everybody to be cognizant when they're going to make a decision about whether or not to wear their masks to go out to Costco, that you take a little step further and think about the other people you would be exposing yourself to in that Costco store as well too, and then make the decision as to whether or not you want to put it on. But that's all that I could offer right now.
Thank you for that response.
And if we can go for one last question from members of the media at this time.
Hi, I have a question.
Go right ahead.
This is Katie from the Orange County Business Journal. So my question is regarding the testing figures. I know they fluctuate a lot, but it appears the 7-day moving average for the number of people tested has been going down in the past week or so. I'm wondering if that's something that you're keeping tabs on and if you have any reason or explanation for that fluctuation.
Thank you for the question. I think testing is one of those areas that is very, it's very nuanced, and I'm hoping that in the past 4 or 5 months that we've been in this pandemic, that everybody has gotten a little bit more educated about testing and how it works. There will always be fluctuations in testing due to a variety of factors. Number one being the demand. And I know that you've all heard us talk about this quite a bit in the past, but when it comes to the demand for testing, there are a lot of things that go into that. Number one, your provider has to feel that you should take the test, and then they will order the test like they order a lab test for you, and then you will take the test. The other factor to consider is the guidance that is issued by CDPH and CDC about who should get tested because of the scarcity of testing supplies and PPE and the whatnot. There's also additional guidance too about what is an essential worker and what is not, who is and who is not. But at the end of the day, when it comes to testing, it is going to fluctuate because it will be most likely an individual choice. Your doctor can prescribe for you to go take the test. You can choose that you don't want to take the test, and you will never go in and take the test. You are an asymptomatic grocery worker, and you know that the state testing sites will test you regardless of whether or not you have gone to your doctor and you so choose to do so that you will go in and you will take that test and the numbers will change. So when it comes to the fluctuation of the testing numbers, I would say that a lot of it has to do with demand. And so if we continue to think about it in that way, I think we'll have a clearer idea of why the numbers are so volatile and they change day to day. I think, again, if you're all on data watch with us, the way that we're watching data is we are looking at the case rate, we are looking at the hospitalization rate, we are looking at the doubling times. If you want to understand exactly how we're monitoring the state of the county, those are the main data points that we are looking at. Some of these other data points are important. I'm not going to describe it that they are not, but they are volatile, and if you really want to understand the purpose behind them or how to read with them, then you get in touch with us and we'd be more than happy to walk you through it.
All right, that concludes our press conference for today. We thank for members of the meeting.